Hello and welcome. My name is Dr. Sandy Nadelson, and I created this PowerPoint in presentation with my husband, Dr. Lewis Nadelson. We are both employees and work for University of Central Arkansas. I'm in nursing, and he is the director of the Educational Leadership Program. And both of us have a very, very deep interest in healthcare and promoting the um, the health of our communities and our health of our world, really, through education. First of all, I want to explain the purpose of this presentation, and that is to help educators understand why some people are more likely than others to use protective devices such as masks, and why others are less likely. What is it that makes them decide to do that or not? In addition, participants, you will by the end hopefully be able to develop at least a few ways to apply this model to enhancing health, face masks, and certainly health in your community. By the end of the presentation, you should be able to explain the health belief model, maybe not in great detail, but you'll get some resources in case you want to look into that more. Describe how and why people are more likely to wear a mask and how that applies to the health belief model through a scenario. And then once again, develop at least a couple of interventions to use the health belief model. So why should we care? I'm hoping I'm preaching to the choir here and that you realize that wearing masks is very important to reducing the deaths that are associated with this pandemic. Often people are reluctant to take measures, and there's a variety of reasons why. And to understand those reasons why they make the choices they do, and then promote that through and some sort of promotion measures and prevention is really helpful. So this is a kind of diagram of infections earlier in this year. You can see year being 2020. Um, the red countries on the left are countries that did not require masks, at least mandatory for everyone, and on the right, ones that did. And as a result, you can see there was a great difference in terms of the number of people who were infected. And there are many articles. Here's a few that you can take a look at if you search Google Scholar and just put in COVID masks prevention research. You will find hundreds of articles that show the importance of mask wearing. So how does this relate to the health belief model? The health belief model once again explains and predicts behavior, and it helps clarify what's going on, and definitely worth applying to mask wearing. Historically, um, the whole health belief model began in the 1950s. It was mainly social scientists from the U.S. Public Health Services that began thinking about, what are these factors? How can we identify? How can we understand them better? And the original has developed a little bit. People have made some twists and turns on it, but overall, it has this most all the same characteristics and explanations that the original did. These are the major concepts of the health belief model. First of all, they are perceived threat or susceptibility in terms of, do people feel like this is a problem for them? Perceived severity, well, maybe they will get it, but maybe it's not going to be severe, or it might be. That will make a difference. Perceived efficacy or health motivation. Those are two terms that are used, very similar meanings. Both of them really refer to, do people feel like they can make a difference in their future? And that goes very closely with benefits. Do they feel there is a benefit to wearing a mask or doing whatever behavior we're talking about? And there's also barriers. We'll talk a little more about what the barriers might be and how to help people reduce those barriers. Cue to action. This is one of the newer ones that's not on all lists, and it's what helps promote people to think, oh, I need to do something. Maybe they see an ad, maybe they talk with a friend or participate in a group activity in which they learn more. So here's a visual depiction. I think this is very helpful in looking at what I haven't mentioned. Some of the other concepts is that there are demographic variables and psychological characteristics of the person and people involved who will make a difference in decision making. For example, age, class, gender can make a difference in whether people want to wear a mask or not. And in addition, the person's personality. Many people are kind of go and getters, hey, well, I'll just go ahead and sew myself a mask. I'll figure out how to do this. Other people are like, I don't think I'm going to do that. I think I'm just going to stay at home and see what happens. So personality, plus also peer pressure can make a big difference. And then once again, these are the main concepts, and there's the susceptibility, perceived severity, health motivation, perceived benefit, and perceived barriers. And those all relate to action. In addition, here's where the clue to action occurs. Whether people have maybe see someone, hear someone, read a pamphlet, maybe get a discount coupon or get a free mask or something like that. Those all help and intervene in terms of the decision-making and action. So let's go over each of those variables specifically, a little more detail. The perceived severity. Many people have been told and are still saying that COVID's not really a worry. It's not as bad as the flu, really, and you don't really need to worry about it. That might be true for many people, but it is not true for everyone. However, that is a fairly widely believed kind of thought on the COVID. And so many people are like, oh, let's just get it over with. Why should I have to worry about a mask? I'll just get it. It's not going to be a problem. No worries. And so feel that the mask wearing is not really worth doing because the severity is not a great concern of theirs. Perceived susceptibility. So many people worry that they may get it, and those are people who are more likely to wear a mask. If you don't feel like you're going to get COVID, you're not going to want to be taking measures to prevent that. So susceptibility makes a difference. People who have been told that they're in a high-risk group, that they're a vulnerable population, people who are older, much more likely to wear masks because they realize that they are susceptible. So some things to think about is then how to help younger people realize that, yeah, you could also get it. It could be severe to you. Around here, I live in Bologna, and there's a lot of people who are like, oh, I live out here in the country. People here don't get sick. We don't have sick people around us, so I don't have to worry about that. They don't feel that they are going to be getting it. They also might feel that they're strong and healthy. Hey, I work on a farm. I'm good. And they also many times do not have underlying conditions that they feel make them at risk. And some of the people, I think it's just that they haven't been diagnosed, not that they don't have them. Let's move on to perceived benefit. Some people feel that, will it make a difference or not? Once again, it's kind of goes along with the susceptibility and somewhat about severity. They just don't feel that the mask will prevent the disease. And I think that has been a problem because COVID initially, CDC was saying, oh, don't wear a mask, don't wear a mask. Oh, you shouldn't be wearing masks. And a lot of people got that in their brain that, oh, okay, masks aren't really helpful. But then CDC turned around and was like, oh, no, you need to wear a mask. And it really gave some people some question then, who do we believe? How do we believe? Not to kind of, feel like, well, maybe there was a change in information. And so, but they feel that they can't trust the CDC and other organizations, and so that the benefit of the mask now is pretty much minimal, if nothing at all. Another barrier, some people really have some issues with getting a mask, and it might be they can't afford it, or they don't have access to a mask, they don't go into the city and they don't sew. They may also feel embarrassed. There's definitely some peer pressure going around, particularly I notice younger men. They're like, we're tough. We don't have to deal with it. Even men in their 40s and 50s as well, and 60s, 70s, it goes up. Age definitely changes the feeling of susceptibility, but It doesn't get rid of for everyone. So, sense of claustrophobia. Some people feel very closed in when they're wearing a mask, and that is definitely a barrier. Another one that I've spoken with some people, even here right at my house, someone was telling me that, oh, when you wear a mask, your carbon monoxide rates in your body go way up, plus your oxygen levels go way down, and so it's really toxic. You shouldn't wear them because it's toxic to you. And he obviously had very little understanding of anatomy and physiology, and not that I could have possibly taught him all he needed to know, but he was not going to change his mind. And unfortunately, he became very angry when we even questioned him on his health belief and where did he get that information. But to him, it was true. It was gospel. It wasn't going to change. Well, let's talk about the health motivation and self-efficacy. This is a very important one, and it is somewhat hard to change, at least short-term wise, because it's something that is fairly ingrained in people. There are many people who feel that, like I mentioned before, if you're going to get it, you're going to get it. It's fate. It's God's will. You might as well just kind of buck up and deal with it. And those are people who are less likely to wear a mask because, once again, they feel it's out of their hands. They don't have that inner power to make a difference, feel that they cannot change their future. And if you're interested in this topic and learning more, take a look and do some research into learned helplessness. They've done research even on rats and found that even animals will learn to be helpless, learn because of their environment that they cannot control what's going on with them, and reduce their activity to prevent even shocks of electricity. It's really sad, but a very interesting topic. So that cue to action. This is what can help people kind of move forward and do a health behavior that they may not have initially thought. Things like a public health announcement, public service announcement on the radio talks about, the benefits. Here's where you get the masks. We're giving them away free this week, blah, blah, blah. That can really help move people forward. Also, having symptoms, if people have a cough or they're feeling some sort of pain or maybe feverish, that can be a cue that, ooh, wow, I guess I could get it. Maybe I need to do something. Another cue, unfortunately, can be seeing something like a funeral notice or hearing about a friend who died or became very seriously ill. So, what might be some clues that you could help come about in your area and help people figure out that, yeah, this is something I need to do here? So, reviewing the health belief model, remember the major factors: perceived threat or susceptibility, severity, self-efficacy, health motivation, perceived benefits, perceived barriers, and clues to action. So let's think and let's talk about applying your knowledge. How could you make changes? And let's think about each one. How might you be able to change one's threat or susceptibility? Could you provide some information? Could you maybe have someone talk to a group of people about, hey, this is a possibility? You may be someone who recovered from COVID, or maybe a nurse or a physician in your area who've been caring for people. Let people know that really this is something that you need to be worried about. And that goes along with severity. It's not just a little kind of fever and I didn't feel good for a day for many people. Now it is for some. Some people don't even have symptoms at all, but others can get very, very ill. And I think another thing to point out to people is maybe you won't get ill, but if you give it to your mom or your grandma or your grandfather or an uncle or aunt, and they become seriously ill, that would leave you with a lot of guilt and a lot of feelings of regret. So that might help motivate people in terms of severity. Self-efficacy. Once again, this is not something that can be changed easily, but encouraging people that, yeah, you can make a difference, and maybe bringing back some things. Oh, remember when you did that? That made a big difference. Maybe, when you remember when this was a problem and you did that you were able to really kind of resolve that through your own powers, and helping people see that they are able to change their future. Super important. perceived benefits, helping people realize, hey, there are some benefits to having this. You can feel empowered. You can be a role model. You can show other people that I care about you. I am caring about you. I don't want to pass on a germ to you or pass it on to someone else. So they may feel more proud of themselves for doing that. And then reducing the barriers, those barriers, could I am part of a group of people who makes masks for free and we give them away. Could you do some sort of giveaway? I can connect you with some groups that do make masks or connect you. You could connect with maybe church or some women's groups or schools. Some schools and their sewing classes have been making masks. It's really kind of fun for the kids. So that might be a way to reduce some barriers in your area. So think about that. In your area, what might happen? What could you do to make people have a change in one of these areas? So finally, in conclusion, the health belief model can be useful for educators in terms of understanding face masks. It also can be used in other diseases. They've looked a lot at things like colon cancer, asthma treatment, things like that. So how could you help develop interventions that would help promote health in your area? If you would like further resources, like I said, lots of articles on masks, but also here's some good basic information about the health belief model by Lamont. It's on the web. It's available to anyone. Wikipedia actually has a nice kind of overview of it. That's where I got the diagram for this presentation. And there's a good video, fairly short, on health belief models. Actually, there's a lot of them, but I chose this one here. Well, I hope you'll take advantage and look at some of the resources. Feel free to contact me at Central Arkansas. My email is snadelson1@uca.edu, and would love to hear from you. Bye now.